The Democrats cry Medicare-for-All and Republicans shout repeal Obamacare. Meanwhile, the price of U.S. healthcare continues to be unaffordable for most. Delays for seeing your doctor are extending out months, and Medicare is destined to go bankrupt in 2036. The ideas coming from Democrats and Republicans are hyperbole and not solutions. They have no clue how to solve our healthcare problems. This video will outline the United States healthcare problem. I will then highlight how universal healthcare has worked in other countries and why it may fail miserably in the United States unless we get our act together. My name is Jeff Schuster, and you're watching Reengineering Politics, which provides objective information on political matters so that you can make informed decisions for a better America. Healthcare has been used as a political and emotional football in politics, and I plan to take some of the emotion out of this topic by illustrating the economics of healthcare and why this problem is more challenging than you're being told by power-hungry politicians. Healthcare costs have risen at a rate of 6 times greater than the rate of inflation since 1970. We are spending 20% of our gross domestic product on healthcare in 2024, when we used to spend only 7% of our GDP on healthcare in 1970. U.S. per capita healthcare costs are double the costs of other industrialized nations. Medicare will run out of money by 2036 if we don't change our ways. The primary purpose of this video is to diagram the problem in such a way that the viewer of this video will not be fooled by the idiotic statements made by politicians from the left and the right. I will outline each element of our healthcare costs that are contributing to our current situation. Advancements in medicine are a great thing. Anytime I visit a hospital, I'm impressed with the new gadgets. Advanced imaging equipment like MRI machines and CT scanners are a few of the new and very expensive gadgets in hospitals these days. Some of these advancements improve efficiency and they reduce the cost of medical care. However, most of them add procedures that never existed and they cost more money. This net increase in costs is estimated to add an additional 15% to the cost of healthcare. Every business has a burden associated with administration and overhead. In the healthcare business, administrative costs are overwhelming. Each time you get a medical procedure or you see a doctor, there's a ton of paperwork required to bill insurance companies, bill the patient, compensate the healthcare professionals involved, and then update the medical records. This administrative burden has grown over the years after HIPAA and other regulatory requirements. This effort adds an additional 15 to 30% to the cost of healthcare. Let's call it 25%. Because some healthcare procedures can be extremely expensive, insurance companies offer risk protection no different than car insurance or home insurance. An insurance company's business is to collect insurance premiums, pay out claims, and still have some money left over to reward shareholders in their company for taking on these risks. Health insurance has been around since World War II. However, insurance pays a much larger portion of the healthcare costs today than it did in the 1970s. Insurance was originally used to cover catastrophic costs. Today, insurance is used on a regular basis to pay for all health care. Because more health care costs are paid for by insurance, the insurance company is taking on greater risk. This greater risk results in greater profits. I'm estimating that health insurance profits are responsible for an added 15% of the cost of health care in the United States. If you're covered by insurance, I'll bet you have no idea what your last healthcare procedure costs. Why? We don't shop around or care about healthcare costs because our insurance company pays them. And our insurance company doesn't care how much our healthcare procedures cost because they make greater profits the greater the cost. The only pushback on cost experienced in the healthcare marketplace is the cost of the insurance premium. And sadly, all insurance companies seem to charge the same premium because they all pay the same inflated costs and are not incentivized to reduce their costs. Governments attempt to negotiate better costs in universal healthcare systems, and they may even eliminate some healthcare procedures. They do this because they are the single buyer and must keep costs below their taxpayers' budget. While this universal healthcare negotiation is better than paying top dollar, it's still not the amount of reduction we'd see if we shopped around for the best price. So very recently, I had to get a dental implant. I don't have dental insurance, and even if I did, it wouldn't have covered this procedure. I shopped around, and I got three prices: $4,000, $3,000, and $2,800. I felt the dentist charging $2,800 was experienced, and he would do a good job, so that's who I chose. When dentists know that you're going to shop around, they'll do what they can to achieve a competitive price. This is not the case in our medical system. For those of you who are excited about universal health care, it may help you to know that doctors, nurses, and other professionals earn about 60% in the universal health care systems of what our doctors and nurses earn in the United States. In the case of my dental implant, I didn't know or care what the dentist earned as long as I believed I was paying a reasonable price for quality care. So cost competition can only occur when consumers know what the price is and they can shop for the best value. I have conservatively estimated that the non-competitive nature of our healthcare system adds an additional 25% to our cost of healthcare. Moral hazard is defined as the lack of incentive to guard against the risk where one is protected from its consequences. In our healthcare system, I can eat bad food, I can sit around and get fat, and if I develop heart disease, my health insurance company pays for a triple bypass so that I can go on living. Many people take their health very seriously. They exercise, they eat right. However, statistics indicate that most Americans do not take care of themselves when compared with other developed countries. My wife and I recently visited Sweden and noticed that most people ride their bikes to get around. Maybe this is why Sweden can afford to offer universal health care. I believe this moral hazard is adding another 40% to the cost of health care in the United States. Many people are covered with health insurance by their company. Many more people are not paying for their health insurance. This non-payment is occurring through Medicaid and Medicare and through other programs that pay for people who cannot afford to pay for themselves. Now, in some cases, it is for people who cannot pay their current medical bills, requiring healthcare providers to charge more to others who are paying. Some of you may argue that Medicare is being paid through payroll taxes, and I'm going to remind you that Medicare will be going insolvent in 2036. This means that these taxes withheld to pay for Medicare are not sufficient to pay for the cost of medical treatment through Medicare. This means that Medicare recipients are net freeloaders. I am estimating that the added cost for freeloaders is another 40%. Imagine a healthcare company needs $1 billion to serve 100,000 people in a population. A large user of medical services claims that it wants a bargain for its 60,000 members. So this healthcare company and the large user negotiate a 25% discount from its normal price of $10,000 per person. Now, another large group of 20,000 members gets a 15% discount. There are now 20,000 people left who must pay much more than full price. If you do the math in our simple example, this weak negotiator group must pay $19,000 per person for the healthcare company to achieve its $1 billion revenue number. This weak negotiator factor affects U.S. citizens on drug prices when compared with other countries who use their governments to negotiate much lower prices on drugs. The drug companies still want a specific amount of revenue, so U.S. citizens pay the higher price as the weak negotiator. This happens with large companies versus small companies as well. I experienced this firsthand when I purchased health insurance for my employees, and then I saw the price the company that acquired my company was paying for the same level of health insurance. I estimate this weak negotiator added cost is adding an additional 45% to the cost of healthcare for most Americans. This number may be higher for doubly weak negotiators and half for employees of large companies who benefit from some negotiating power from their large company. The great news is that people are living 10 years longer in 2024 than they were in 1970. This is partly due to dropping the cigarette smoking habit that was prevalent in the 1970s. However, much of this increased lifespan is attributed to great medical care for seniors. Instead of dying from a heart attack, you can live longer through a heart valve repair or replacement. While it's great to live longer, this longer life is coming at a price. Based on the medical costs for older versus younger people, this added 10 years of lifespan is adding an additional 4.5% to everyone's medical costs. When you multiply each value that I just mentioned on subsequent increases, you can see how we pay 6.14 times more today than we paid in 1970. So I've acknowledged that I've estimated many of these increases based on articles that I've read on this topic. Most of the researchers of those articles had to also make estimates as there wasn't enough data to get exact amounts. While non-competition may be more and weak negotiator may be less, the total factor of 6.14 is correct. So here's a graphic from Kaiser Family Foundation, or KFF, that shows how inflation-adjusted costs have increased since 1970. When you take this entire cost and then divide it by the population in 1970 and then compare it with the population in 2024, you get a cost increase per capita of 6.14. You now know what is contributing to the high cost of healthcare, and you may be asking, so what? That's a great question. Now, I don't think that we can put the genie back in the bottle on healthcare advancements or on lifespan, nor should we. However, many of these other factors can be addressed to reduce the cost of healthcare in the United States. It would be a major mistake if we tried to do a Medicare-for-All or universal healthcare system with our current cost control problems in healthcare. If we eliminated insurance companies and we had the government manage everyone's healthcare the way that they manage Medicare, our entire healthcare economy would go the same way as our current near-insolvent Medicare system. This is a difficult task, but Americans must take their personal health seriously. This is not something the government can or should control directly. However, there can be penalties or less coverage offered for those who participate in health-risky lifestyles. The best way to accomplish this penalty is through health taxes on foods that cause obesity or cigarettes or alcohol, guns, and any other statistically relevant cause of higher medical costs. Higher taxes on these items can only be used to fund health care spending by the government and not other expenses that the government just decides to spend money on. There are so many backroom deals made between insurance providers, healthcare providers, and the government that it is difficult to know what the cost of any medical procedure will be. Before the United States decides to pay for everyone's healthcare, we must understand what various procedures cost. According to a report published in 2024 by the RAND Corporation, private health insurers are paying 250% more than what's paid by patients covered by Medicare. This may look great for Medicare, but it's terrible for privately covered patients, and it confuses the actual price for specific medical procedures. Hospitals and other healthcare provider groups must price their services so that consumers can select the best value provider. Prices cannot be hidden in negotiations so that consumers are unaware of the deals that others are getting. This will improve competitive pricing, and it will eliminate weak negotiators who are paying top dollar when large buyers are getting large discounts. Once we have a system in place for guaranteeing competitive prices for all medical services, and we have a penalty taxation in place for reckless health behavior, we can move forward with universal health care. I'm going to freely admit that I was not a fan of universal health care when Democrats came up with the Affordable Care Act or Obamacare. I was fully aware as a private health insurance payer that my price would go up, not down with the ACA. Indeed, this is what happened. After the ACA was passed, healthcare costs increased greater than the rate of inflation and have been increasing at a greater rate than other developed countries ever since. If we can get rid of the moral hazard and get cost transparency and improve cost competitiveness, we must then move to a universal healthcare system. And here's why. Other countries are strong negotiators because they're negotiating on behalf of millions of patients. If the United States doesn't move to a universal healthcare system, we will always be a relatively weak negotiator when compared with other national healthcare systems. The irony of the U.S. adopting universal healthcare will be that drug prices will increase for countries who now revel in a strong negotiator status. Here is how our healthcare prices can become more reasonable. We can get our healthcare prices down if we can reduce our moral hazard, increase cost competition, and create transparency in costs so that the United States is not paying top dollar. We can reduce healthcare costs even further if we implement a universal healthcare system, keeping our cost competition and reduce moral hazard systems in place. This reduction will come from eliminating most of the insurance company profits and implement a Medicare-for-All system comparable to Medicare that's currently being offered to seniors over 65. If we can cut healthcare costs in half, Medicare will last longer. It must be understood that while overall healthcare costs are cut in half, Medicare costs may remain the same as they are today because Medicare is currently getting an unfair pricing advantage that will be balanced out in a new, transparent, and competitive pricing system. A new evaluation of the Medicare system must be made and incorporated into taxes that will be used to pay for a universal healthcare system. Now, these taxes withheld to pay for universal healthcare should be less than the healthcare benefits withholding that employees and employers currently pay for their healthcare benefits. If an employer currently doesn't offer a healthcare benefit, they will experience higher costs in tax or payroll taxes than they did before, but less than if they were to offer a health benefit program today. If you have not experienced Medicare, you probably don't understand that Medicare is not an infinite coverage plan that pays for anything that you want. Much of the basic health care is covered by basic Medicare. However, if seniors want full coverage that will be comparable to a premium private health care plan, they must purchase Medicare Advantage plans that supplement their coverage. These same supplemental plans will be available to all people in a Medicare-for-All system. However, they must be purchased by plan participants and not provided at no cost by the government. The right doesn't like the idea of universal health care with good reason. There are 3 risks associated with a government meddling in any marketplace. When demand outpaces supply, scarcity is the result. If everyone can receive health care and they want as much attention as they do today, long waits and unavailability will be the result. This is happening now, and we don't even have universal health care. Today, you must wait months for basic medical procedures because healthcare demand is outpacing healthcare supply. The typical wait time for a medical procedure in Canada is over 6 months. In fact, it's 27.5 weeks to be exact. The average wait time for a medical procedure in the United States is 26 days. If we do not solve our moral hazard problem before we transition to universal health care, demand will outpace supply and cause greater scarcity and much longer wait times. The United States has a universally available system in place today. It's called public education. In truth, a public school in Chicago, Illinois is different than a public school in Spokane, Washington. However, they all have something in common. Public schools pay bottom dollar for unionized teachers, some of whom are excellent teachers, and some of whom are terrible teachers. We know that students receive a much different level of education from each school district. It's also known that the cost of that education varies widely from district to district. Ironically, the cost of public education has no correlation to the education outcome of each of these public institutions. I'm going to eventually publish another video on education, so I don't want to dwell on those problems here. But if you could imagine a healthcare system being operated the same as our current public school system, you may be able to quickly identify the problems we'd have with government-run healthcare. So here are a few challenges that come to my mind. Poor customer service, low-paid professionals, inconsistent quality, stifled medical innovation, corrupt relationships between suppliers and government leaders, and a high-income earner flight to private providers. I'm sure I've missed a few, but you get the picture. In our current mode of operation, private paid services pay 250% more than Medicare for medical procedures. This means that private payers are subsidizing health care of our current Medicare system. The healthcare industry is okay with this imbalance because, it seems to work. The working class have jobs, and their companies use their earnings to buy top-dollar health care. This private money pays for overpriced drugs, overpriced medical procedures, and overpriced everything else so that the Medicare system won't go bankrupt sooner than 2036. If there is a Medicare-for-All system, there will be no money coming from the working class and the wealthy to offset the large discounts currently being given to the folks who get government-paid health care. One of two things is going to happen. The cost of Medicare for All must increase to offset the current imbalance, or the quality and availability of health care must decline for everyone. I have experienced firsthand the trial and tribulations of health insurance in the healthcare industry. In the 1990s, I was coddled by corporate health benefits that paid for any health problem experienced by my family. In the late 1990s, I found out how expensive and difficult it was to get health care coverage as an individual buyer of health insurance. Each year, insurance companies claimed that they would not cover what they covered the year before because somehow we now had existing conditions that wouldn't be covered in the subsequent year. In the 2000s, I struggled to pay for affordable health benefits for my employees as a small business owner. We had to belong to a PEO or a professional employer organization to afford health benefits. In 2012, when the Affordable Care Act was ready to go into full effect, I had had enough. I understood what this would do to my health benefit costs. This was one of the deciding factors to sell my small business and get the cheap health benefits of a large company once again. And I was lucky that I did because that year I was diagnosed with a failing heart valve that needed to be repaired. The cost of that procedure would have been $450,000. The old system was and is a failure. The Affordable Care Act helped low-income earners and the individual health insurance marketplace, but it did not help the affordability of health care for most people. Universal health care can be a great solution. Companies can stop focusing on health benefit programs and start focusing on their business. Small businesses will not be disadvantaged by the better health benefits provided by large companies. People who are struck with medical problems will not go bankrupt. However, I will caution any of you who jump on this bandwagon prematurely. If we don't solve our moral hazard problem and take our personal health seriously, we will be worse off with universal health care than we are now. I want to thank you for visiting Reengineering Politics. My book, Engineering Unity, also has a chapter on healthcare, as well as 15 other topics that illustrate the viewpoints of the left, right, and center. I have left a link to purchase this book in the description below, and I'd love it if you like this video and you subscribe to the Reengineering Politics YouTube channel. Thanks for watching, and I hope you return for more political insight that's neither left nor right.